Hi, I'm Joan Lawson, and you're wondering why I have this beautiful scarf on? Well, the State League board members bonded during COVID, and so now we get together every half a year. And it happened to be we got together a few weeks ago, and since I'm going to have my 90th birthday, they gave me this lovely scarf, and it has the Statue of Liberty and the names of important women in history, including, what's her name? Cat? Carrie Chapman Catt, who started the league 104 years ago. So I invite you to look at these names afterwards. Why should we know about public hospital districts? Well, we're fortunate to have two experts on this topic, and these are little-known public entities that provide important health care services to meet needs identified in their communities. Cynthia Stewart has come to us from Olympia to describe how the League of Women Voters of Washington has provided information about these districts to increase public engagement with them. Cynthia is a League of Washington board member and head of the lobby team. She's a member of the Public Hospital District Education Committee. You may remember she was here at the start of Earth Month in April. And she can tell you a little more about herself when she speaks. Horizon House resident Neil McReynolds is chair of the Advisory Council of the Board of Commissioners of the Leavenworth, Chelan County Public Hospital District Number 1. He'll describe decisions with which board members grapple. Neil served on 60 boards over the years. Can you imagine? And he'll tell you some of them, but the ones I know about are Bellevue College, Overlake Hospital, Fred Hutchison Cancer Research, and the board of Horizon House. He was also press secretary to Governor Dan Evans and taught CEO and board leadership. So I hope that he will tell us a little bit more about his background. So we will hear from Cynthia and Neil now. So Cynthia, thank you for being here, and we'll be delighted to hear what you have to say.
Okay, can you hear me all right? Okay, well, my name is Cynthia Stewart. I am with the League, State League Board, and the chair of the lobby team. Joan asked me to talk a little bit about my background, and you probably wonder why I'm on this committee. I actually started my career in healthcare, not as a practitioner, but as a person who organized community around healthcare issues. And I worked for Group Health for a while. I worked for the state of Washington for a while in the Department of Health. I then went through a series of other jobs, including policy analyst, including deputy director of the Solid Waste Division in King County, manager of Boeing Field Airport, and I retired as the county deputy manager in Thurston County. So, I did some consulting in there somewhere too. So because I have a really broad background and because I'm always curious, I get involved in things like this. This project was started several years ago. The way the League works is that the State League undertakes studies, civic education projects, and other action based on what the membership passes at convention. So a group of people who were concerned about the fact that so many people are getting their health care exclusively, have no other options from religious organizations, felt like it was important to let the public understand that public hospital districts are an option. In some places that the League is involved, where they have those concerns, they're looking at forming one, or they're looking at expanding the services in their public hospital district. So what I'm going to do is I'm going to walk you through some of the information that we've provided for the public about what the heck is this thing. Why would anybody care about it? How does it work? How could you get involved if you were interested? Now, in King County, there is one, but my guess is most of you aren't that interested in it, but we'll talk about that as well. So I'll go ahead and get started here. And by the way, it's a pleasure to be back. I meant to start with that. I really enjoy coming here. I've come here both with the League and also for other reasons, so it's really fun. And thank you for being here. So what is a public hospital district? The state of Washington allows certain jurisdictions to be formed by a vote of the people. And those are typically called a special purpose district. And they are approved by the voters, and they have a tax funding base, typically. They are set up with certain kinds of services that the voters approve. They have an elected board of directors that is elected by the voters in the district. And in this case, a public hospital district is not a public health district. And people get that really confused a lot of the time. So examples of other types of special purpose districts are the ones here. The library districts are an example, parks districts, flood control districts, transportation benefit districts. They're all formed in the same way by a vote of the people. The people get a proposal that says, here's the boundary, here's what we want to do within this, here's what the voters will decide, and then they put it on the ballot. So this is really no different. So, and as I just said, the boundaries, the purpose, and then tax financing. Usually there's a proposition to put a levy on the ballot as well to help support whatever the special purpose district is doing. And then, as I said, voting for the commissioners. So in Washington State, here's a map of, you can't really read it, but you can see how many there are. There are many, many public hospital districts around the state of Washington, and they're fairly well distributed across the state. So what I'm going to do now is just play a very short video that is more colorful presentation of what a public hospital district is and how it works. And it will also feature the one in King County as well as others. So I'm going to go ahead and show that.
I've lived in Forks most all my life. I'm 58 years old. I was gone 7 years to school and lived here the rest of that time. My wife and I run a bed and breakfast on the edge of town. We take care of, anybody that comes to visit, people that are working here, fishermen, people that are coming to visit the national park, and recently Twilight fans coming to see the town of Forks. Forks has a very delicate fabric, I guess, of how we exist here, both in jobs and in the services that are provided to the town. And without a hospital, we have 60 miles to go to Port Angeles or 100 miles to go south to Aberdeen. If we didn't have a hospital here, we'd be losing people.
Well, I think that's one of the important aspects of this community. Here you are in what some people would say is the middle of nowhere or a very rural area, and yet we have this world-class hospital and also hospital clinic with a lot of very qualified physicians and practitioners to care for us. So we feel quite lucky.
Well, the great thing about a public hospital district, it's owned by the patients and citizens of this community. We're a nonprofit governmental entity that's focused on providing the best possible health care to our local community. And it's very rewarding for our medical staff and our employees because our mission is very significant to our community.
Our hospital district covers 800 square miles of northwest Kittitas County.
We are a 25-bed critical access hospital, so the only hospital in Jefferson County.
Soap Lake is a small community. It's one of the communities included in the district. We're a 42-bed facility. We do long-term care, that's our specialty.
No matter whether it's a public district hospital that's in an urban area or a suburban area such as we are, or in a rural community, each one has its differences and its special nature, but there is a common theme.
As a public district hospital, we receive taxes from our district residents, and that's the difference between being a public district hospital and not. And so roughly 5% of our revenues come from a tax base.
Those funds help us to do amazing things in our community that otherwise wouldn't exist, because there is no sound business model underneath of them to allow them to exist, and yet they very much need to exist. Senior services, grief and bereavement, the ability to have a 24-hour nurse call center.
I would think that a hospital out here, if it wasn't a public hospital, would be challenged to financially manage itself. Say a privately held hospital, I think probably what would happen is there would be some clinical coverage, but there wouldn't be the full-scale hospital that we're so blessed to have here.
Growing up, I can remember times with 105-degree fever and, mom bringing me down. And, when a mother is worried about her child, then they need a place to go to. So this is it.
The public hospital district model is basically a model that allows the local public to be involved in the leadership, provide a board and the leadership and community support to the hospital.
I'm currently the president of the Board of Commissioners. I'm a commissioner for Public Hospital District Number 2 in Clallam County.
And we've invited the general public to show up and voice their suggestions.
Our job is to make sure the policy is set, to see to it that we're running legally. We have fiduciary responsibilities of various kinds.
There's a different connection that our commissioners have compared to other organizations I've found, where they not only help govern strategy, policy, selection of the CEO, but they are representatives of the community, and it creates just an additional but very powerful connection.
We're constantly talking to our community and getting feedback from our community. One big thing is our Sequim residents, which are about 16 miles away from the hospital, really wanted some kind of urgent care walk-in clinic. So if they needed urgent care, they didn't have to come all the way to the hospital and wait in the emergency room. So a couple years ago, we started a walk-in clinic in Sequim, and that's been very successful.
The hospital is such an essential component of our social fabric that it feels good to have something to do with it, to have some ability to control what happens.
Together with Olympic Medical Center, who is also a public hospital, we were able to join with them as well as Forks and form a coalition. With this coalition, we were able to develop an improvement in buying power as far as being part of a larger buying group and access to upgrade in our medical information technology.
District 1 and District 2 have an interlocal agreement which spells out some services that they can provide to each other.
I've been fortunate to be able to travel across the state and across the country and talk to peers in emergency medical service and see other systems for areas of this size. And what my experience has shown me is that because of the relationship that we have between Hospital District 1 and District 2, we're able to provide better services and a higher level of patient care than would otherwise be available if that partnership did not exist.
Healthcare is really local, and having a local public hospital district working with the entire community, including the other healthcare providers in the community, that's the way healthcare reform is really going to happen. Making this healthcare delivery system better isn't going to happen in DC or even Olympia. It needs to happen boots on the ground in the community, working with a variety of partners.
There's many moving parts to the Affordable Care Act, and we're hearing there's a lot of new terms and new concepts being brought forth, including accountability, the accountable care organizations and payment for performance. My conclusion about a public district hospital, in addition to the things we already talked about, it is the essence of an accountable care organization. We are an ACO even before that became a popular term.
We're totally committed to this community. That's all we do. And I think that adds a level of engagement that makes a difference for our patients. Public hospital districts are very unique. And I think in rural areas, given the economic pressures, a much larger population of poor patients and elderly patients and uninsured than urban hospitals. And I think it requires unique dedication and focus to meet a community's needs.
My mother, in the last year of her life, spent a year here at the Forks Hospital long-term care. And it was so nice for us because she was in Forks where we could visit her every day, you know, evening, morning, whenever we wanted, instead of making a long 60-mile trip to Port Angeles. And because the hospital is under the jurisdiction of a board of directors that are elected, they're very accountable to you know, the needs of the community. And one of those needs is the long-term care. And so I just think that she got the best care possible. I consider all of her caregivers a group of angels, and we just couldn't be more pleased. And I don't think we would have that without this facility here.
So I think you can see that they have a lot of versatility. There are all different types of public hospital districts, and the funny thing is they're not just hospitals. So there are some districts that only provide EMS services. There are some districts that provide, as you heard, long-term care, all kinds of other things. What I'm going to do now is show you a little bit more in detail about some of the things that make this all happen. And I'm going to use the Evergreen one here in King County as an example. So again, the voters elect the commissioners. It's kind of like electing your county commissioners or your Seattle City Council or whatever. And so these are the people who are operating the Kirkland Evergreen Health. Public hospital districts have a certain set of powers and responsibilities. And so one thing that they are supposed to do is survey other facilities. They need to know where they fit into the system, where they fit into other corporate or private nonprofit services delivery organizations. They have an opportunity to lease, contract, borrow money, and so forth, and to set a property tax levy. So they can sue, they can be sued, just like any other organization, both public and private. And they hire and fire employees, and they can decide what kinds of staff they need. So they're really just like a governmental agency, and that is very typical of other special purpose districts in the state. Now, this is not representative of King County's tax system, but for every public hospital district, you heard there from Evergreen that the property tax is about 5% of their income. And in the case of these smaller ones, it's ranging about 3%. And you can see that the cost per year per house, per residential unit is not that big. So somebody in Clallam County will pay $121 a year for the opportunity to have this public entity in their area. So the typical process to form one is that somebody in the community decides there's a need, and they start talking about it, they organize around it, and then they get documentation to support the idea that a public hospital district should be formed as the solution to meeting that need. They gather support, and they submit to their county government a proposal to put on the ballot. And then when the election happens, the board of the county commissioners put a ballot proposal together that not only approves the entity, but also the boundaries, also the services, the tax, and the commissioners who would be elected for the first time. So the petition has to be signed by 10% of the voters at the prior general election. And then it can be countywide, it can be a partial, whatever the boundaries are that have been proposed. And then if there's a majority vote and at least 40% of the votes cast in the prior election are happening, then it's approved by the voters. And they can have 3, 5, or 7 commissioners. So this is a graphic that just kind of outlines that same process. When I've added the yellow bar, I don't know if how well you can read that on the screen, but the yellow bar has to do with financial feasibility study. That is not mandated in the law, but I've done a lot of work as a consultant with forming other special purpose districts, and would highly recommend that anybody attempting to do this would do a feasibility analysis. And what are the estimated costs? How does that translate into both revenue from fees and charges for service, and also the tax base? So anyway, document the need, do the analysis, gather community support, and put it on the ballot. And it should typically take a couple of years, so it's not a fast process at all. So after the issue is proposed, approved, then the tax collection starts, and they need to have a certain amount of money before they can actually start operating. Then the commissioners typically will hire a consultant or an executive director who will then lead the rest of the process under their guidance. And then they make agreements for what kinds of facilities or services they plan to provide. Obviously, in the case of a hospital, that's a really big deal. It takes a lot of construction. Sometimes these entities will purchase another hospital that already exists. They will work out a way to use existing facilities. Sometimes they're offering services that are not hospital-based, and so that's a whole different scenario. But they work it out, and then they don't start operating until all those things are in place. One of the things that's really important about these is they have to have public meetings. They're just like any other governmental entity. They don't get to go behind closed doors. They have to meet in public. They have to give notice. Now, one of the confusing things is because public health districts and public hospital districts have the same initials, everybody gets confused. And so I just want to point out how they may be different. So in the case of a public hospital district, they have locally controlled healthcare providers, and the public health departments are part of a statewide public health system. So the public hospital district operates more independently. Public health districts operate as part of a larger statewide system. In the case of public hospital districts, they elect their commissioners. In the case of public health districts, the board is typically appointed by local elected officials. And it's quite different in terms of the ability of the citizens to influence the decisions that are being made. In terms of public hospital districts, there's a broad range of opportunity of services. In the case of public health departments, typically, or health districts, either one, they've really narrowed down their focus to things that are prevention related, community health, and things that inspire behaviors that create a healthier community. They're not providing direct health services anymore. So when I started with Thurston County back in the 2007, and then the recession was coming, that's an example of the health district was providing all kinds of direct health services. They all had to be cut out of the budget. So that has happened all around the state, and now what you see is they are not going back to that. So that's a major difference between these two types of entities. And then again, on the service delivery end, hospitals, nursing facilities, and those are all direct care facilities. On the health departments, they're working on environmental health, things that make your community operate better and keep disease down, infectious disease control. The maternal and infant program is a preventive kind of program, and then also family planning. So significant differences in terms of the capacity of the of either case to do what the community needs. So in Washington State, we have 40 public hospital districts that provide hospitals. 31 are called critical access hospitals, and those are in the rural communities where they get support from the federal government to make sure that those rural communities do have hospital services. There are 17 that provide EMS. Now, these numbers don't add up to the total number. They add up to more because some provide more of these some provide only one service and some provide multiple. Oh, emergency management system. So when you call 911 and you get an ambulance that's government supported, that's an EMS system. And thank you for calling that out. Skilled nursing facilities, there are 6 provided by public hospital districts. Long-term care, we heard Forks has it. There are 14 clinics that are pretty much primary care facilities, 5 that provide other kinds of wellness services, and then 11 provide behavioral health services. So again, a wide variety of options, and that is based on what the community has said they need. So in the case of Evergreen, I started making a list from the beginning of their website, and then I realized they actually had an alphabet. So every time you would click on a new letter, you get another list about this long. So I put this site there, but these are some major categories, and under those there's all kinds of stuff. That is an amazing hospital district and providing amazing services. So how do they do this? How do they figure out what the community needs? They're obligated by law to conduct a community health needs assessment at least every 3 years. And so what they have to do is then figure out what the needs are and then how they're going to meet that. And so it's not always a direct line between here are the needs and here are the solutions, but they have to create some kind of a strategic plan that says here's what we're going to do based on these needs that we've identified. And they have to have input from the community in this process. They cannot just do it as a board or a staff. And they have to include people with expertise as well. And then the assessment has to be made widely available to the public. So once they've created a structure within which they do the assessment, and they've included people in that process that are representative of the community and of the healthcare field, then they still have to put it out for public review and comment. And that is how the public understands what's going on and has more knowledge for their voting process. So these are just some slides from the Association of Public Hospital Districts. It's pretty redundant to what we've just said. You can learn about, if you have a public hospital district and you want to learn more, and this is really directed more towards league members in cases where they want to get more involved. You find out about your current board. You find out what services are offered. You find out how they're financed and what their budget looks like. You look at their quality data. How are they getting assessments of the quality of care they're providing? And then what kinds of rules do they have for their meetings? So a league that would want to investigate either expanding the services in one or learning more about it or even created one, that is the process. So again, this is the same. You would get information from your website, annual reports, strategic plans that are online. And sometimes if they're not online, you have to go to the staff and ask for them, but they should be there. Minutes of the board meetings, and then just attending meetings. And I don't know how many of you know that many leagues have what we call an observer corps. These are league members who go out and monitor meetings of governmental entities and then write up a report for the public that says, here's what went on in the meeting. Those people can also be used to provide the community with information about what goes on in the Public Hospital District Commission meetings. So in terms of engaging with a PhD, you would try to build a collegial relationship so that you can all be on the same page. You would want to make sure there's some sense of shared goals, priorities, and so forth. And you would want to be known as somebody who supports the public hospital district so that there's no animosity there, and then help develop mutual responses to local needs and what people are saying is necessary for their community to thrive. So these are kind of common sense things about engaging with your commissioners. Just realize that most people don't know even what a PhD is. They don't have people over getting service from Evergreen don't even know what it is a lot of the time. They don't know that they actually have a board that's elected by them or that their property taxes contribute to it. Know that public hospital districts have a role in the economy that's really important. Recognize that unmet healthcare needs can be met that way if you wanted to approach it that way. And then use the League's tips for engagement with other local organizations and elected officials to guide how you would interact with these board members, commissioners. This is just more of the same. I'm not going to bother to repeat that. One of the things that I found is that most public hospital districts have a magazine that they produce on at least a quarterly, sometimes an annual, but typically quarterly basis. And then many of them have a blog that they publish on their website, like once a month or something. And many have a newsletter. So if you wanted to investigate what's going on, say for Evergreen or any other one that you might be interested in, you would go to their website and sign up to get these or just read them regularly. Get a notice that it's available. So how do you learn from the commissioner meetings? You attend the meetings or you have an observer corps that gives you a report. Tracking the agenda is just like any other elected body. Tracking the agendas and the minutes so that you know what they're actually doing, what they're talking about, what they're planning to talk about. And then make the commissioners aware of the League's interest. So again, this is not really directed at you, but this is what we are telling local leagues who are interested in this, pursuing it themselves. One of the issues that I said at the beginning that created the interest in these was the whole issue of losing the opportunity for reproductive rights. When you only have a non-secular hospital to use or a clinic, and you need family planning, or you need an abortion, or you need some other kind of relevant service, and you can't get it, sometimes that is the way to start talking to your community about forming a public hospital district to address it. But the point on this slide has to do with every hospital and clinic is supposed to post its reproductive health policies online, and they don't. They don't. So there's a website here that if anybody, probably this group isn't that interested, but you might have sons or daughters who are. You can look online, and then if they're not posting their policy, that is something to go after, because it's really important public information. Oops. So there are a lot of other sources of information, and I don't think I need to belabor that point at all in this case. Some leagues are trying to figure out what to do, and so we're suggesting they form a league healthcare committee. Some leagues have healthcare committees for other reasons, but if somebody were interested in pursuing this and they didn't have one, forming a league healthcare committee would be a really good starting point. So identifying potential members, drafting some kind of a committee mission or a statement of purpose that the board approves, and then establishing a meeting schedule and so forth, and then letting people know. So that is one of the other pieces of advice that we're giving to other leagues about public hospital districts. Another idea is to include the commissioners of the public hospital district in the candidate forums and in the Vote 411 process, because they often get ignored. And you can have people running for these offices who have very disparate opinions about things. And so having the opportunity to ask them policy questions and get comparative answers really helps the voters be better informed. And that's the same for Vote 411. So in the Clallam League Healthcare Committee, they contributed questions to Vote 411 for the commissioners of the public hospital district. So then when there's a bond issue on the ballot, one of the things the league does is provide public information. In the Pullman Public Health Hospital District, there was a bond issue on the ballot, and the League Voter Services Committee put out a forum so that the public could be informed, and in that case provided both sides of the question for the audience to hear. And so that's another way that leagues can get involved. And then here are some actions that can be taken when there's a healthcare issue. So first of all, figuring out what's going on. Let's say there is an urgent challenge to the hospital reimbursement and financial stability. That is actually the case in some of these hospital districts. They are not quite making it financially, but let's say that's an issue. Look to the league positions to figure out what in the world you could do to take action on that as a public matter. The hospital district, this whole education thing came along because the league has very clear positions on reproductive rights, but more specifically on equal access to health care. So public hospital districts are clearly one of the ways that people can get more access to health care if it's not available some other way. And then studying and acting, that's what the league does. We do a lot of study, we do analysis, we figure out how to address the question. Sometimes we then take action based on that, advocacy action. Other times it's just public information. And I think I probably said enough about that. So I'm going to offer a copy of this to Joan, and she can provide it. And so we have a list of resources for more information if you're curious about it. And then I'm going to just put this slide on. Thank you for listening. And then Neil McReynolds is going to come up and talk about what kinds of issues is the Citizens Advisory Committee in that particular hospital district dealing with at the request of the commissioners. And that'll give you a flavor, a local flavor of how this works. And then after he's done, we'll do any discussion you want to have.
Thank you very much. Yes, excellent presentation on public hospital districts. So thank you very much. I learned a few things myself. I haven't been involved for a number of years, but I'm here today in my role as chair of the advisory council and at the hospital, our local hospital in Leavenworth, where we have had a home for the last 17 years. And we're still part-timers. We spend most of our time here, but we are over there. And before we had our home in Leavenworth, we had a cabin up at Stevens Pass for 22 years, so a combined 39 years that we've relied on Cascade Medical to provide those emergency medical services. And that's been a very comforting thing. We've used them quite a bit. I've done it myself, as well as our other family members and guests have over years used the Cascade Medical Services while they've been there. So it's one of those things that's nice to have and rely upon. I think Cascade Medical is an example of a public hospital district, which you saw on the video just now, and you hear more about it here in the minutes ahead. But so I've been asked to describe how does our advisory council help the Leavenworth community. Well, first place, I think we don't make decisions. We make recommendations or offer our comments when asked. And I think that's important not to forget. So that, but we do have an active role. And so we do have, I think we don't have a fiduciary responsibility that a public body would have, or a business organization would have, for that matter. And we don't attend commission meetings regularly, except as needed. And we're strictly advisors, and so we actually 5 elected commissioners in our case in Leavenworth, and the advisor to the CEO. So let me explain what we do as an advisory council. But first, I think it's worth taking a moment to talk about the hospital district, as formerly called Chelan County Hospital District Number 1. We were established in 1965. The Cascade Medical, that's the name we operate under, and that serves 4 communities spread across 1,200 square miles in the upper Wenatchee River Valley. The hospital district includes 10,000 residents and supports for nearly 3 million tourists who visit the area each year. That's a big factor. Cascade Medical serves 2 interstate highways, which go over 2 mountain passes. It also serves the Stevens Pass ski area and other recreational areas like Lake Wenatchee and the Wenatchee River, in addition to the residents of the district. This is the area that Cascade Medical serves, with the primary responsibility falling on 5 separately elected commissioners, which you heard about previously, and I think Cynthia did a nice job explaining that whole process. Our role as an advisory board is to make suggestions and raise questions, as well as to respond to requests for input from the commissioners. Our advisory council was formed 13 years ago by the commissioners who were concerned about a number of part-timers moving to the area, both from the standpoint of increased demand for services and from the standpoint of possibility of additional business for the hospital. The number of part-time residents in the district, especially in the Leavenworth and Lake Wenatchee area, has increased dramatically over the last 13 years and continues that way. I think every year is showing a significant gain. Also, the other part, the commissioners, other reason commissioners decided to create this advisory council was they've been concerned about the practical aspect. All these part-time residents pay taxes to Cascade Medical, property taxes, but they don't have a vote. And so the commissioners wanted to be sure that the voices of part-timers were being heard. That prompted the formation of this advisory council 13 years ago. So over these years, we made suggestions to the hospital commission and management, as well as commenting on plans of action that are being considered and bringing forth new ideas to the commissioners. To give you an idea of what we do to help the commission, there are 2. I took a look at the agenda for our last meeting, which is just a month ago. The commissioners asked us to 2 significant things we spent much of our time talking about. Was the input, they want to input on the property tax levy that they were going to be putting on the ballot sometime in 2025, and they wanted to get our thoughts on that one. And they were asked for the general impressions of the necessity of the levy and whether it's really a good value to the community. One question. Another one was, what are your general impressions of Cascade Medical's emergency and ambulance services? And thirdly, what do you think are the most important facts, details in which to educate our community on the particular issue? So this is the kind of thing they were asking us for input from those of us who are not in the healthcare, but certainly benefited from their services. Well, the second major area that is something that we just heard about was the community health needs assessment, and then their process of doing their assessment, the current update, the one they did 3 years ago. And so they're in the process of doing that, and so they ask a number of questions, and questions like what information should we understand about our community as we perform our next assessment early in 2025. The other one is, what data do we want to look at? What groups of people should we survey? And so other things, other ideas are looking at how to make this a comprehensive look at the needs of the community. So we had a good discussion of these 2 topics. And as always, we had one commissioner there. We either have 1 or 2 commissioners there at every one of our meetings, and they report back the results to the other members of the full commission. Well, that's a description of how our advisory council operates and supports the hospital district. So I'm happy to answer any questions during the Q&A. Thank you.
So what would you like to know more about? Yes.
Well, I heard that Cascade.
Okay. Do you want to, are you able to pass it around? Okay.
Thank you. We heard that Cascade Hospital, the way the commissioners and the advisory committees work, and I also heard that you provide ambulance service, but I'm curious as to what kind of a service area you have. What are the services that this Cascade provides? other than ambulance service? I mean, do you, yeah. You have a hospital?
Yes, we have a few beds, not a lot. We have probably 5 beds. And so we take most of them to wind up with, we take a look at them, figure out where they go, and usually take them to Wenatchee, which is 20 miles away. So, or send them to the west side.
So any other services you provide?
Other side, we do have doctors in there taking clients, just walk-in type clients, and a lot of emergency type services I mentioned. But we have much education in the community is a big one. They do a lot of educating the community there. And what else? I was trying to think of some of the other things that we do that, as mentioned, providing clinics. We have a low-income population there. See, even though there's lots of nice homes being built up there, there's still a lot of other folks that need services, and we do efforts to do that through clinics, not just in Leavenworth, but around this large district. And that's a significant effort on our part to get that, to make those services available. It's 1,200 square miles, which, yeah.
So,
yeah. Sure.
The Catholic Church has been everywhere. Have you been able to resist them? How much pressure are they putting on anyone or all of your public health?
You want to
Yeah, I just want to say that the non-secular healthcare providers are working within the private sector, not with the public sector. So they can't take over an entity that was voted in by the people and that the people run by a democratic process. So they're only operating in the private sector area. And a lot of areas, you saw those circles on the map, you saw how much of the map isn't covered by a public hospital district. So there's a lot of territory for other private sector groups to cover.
Okay. I've had a little firsthand experience with Cascade Medical, and they have urgent care, they have emergency care, as Neil mentioned, ambulance service, which we called one time in the middle of the night. They were there in 9 minutes. So it's excellent care. They have state-of-the-art physical therapy, including a therapy pool. I got a CAT scan there. So there's those sort of everyday things are definitely available.
So I just want to ask Neil, is this because that's what the community identified as a need?
That's one of the ways it came about, yes. Mm-hmm. Yes.
I'm sorry that I missed the beginning. Okay, I'm sorry I missed the beginning of the presentation, but my question was, what interaction do you have with the local health department? And the reason I ask is because I was, for 11 years, the health officer for Kittitas County, which is just south of Chelan County. And a lot of the public didn't know what the health department did. They know what the hospital districts do, but the health departments are charged with dealing with health with less advantaged people. For example, in Kittitas County, we had a lot of migrant people down by the Columbia River. Again, it's one of those large counties in eastern Washington, and we also had an advisory council, and we also had a board of health, which we expanded to include somebody from the hospital district, so that the county commissioners who were running the health department would know something. The county commissioners aren't always very sympathetic to raising any increase in expense at all. And we had to convince them why it was to their, I remember one new county commissioner said, you can talk about anything you want in the health department. I was the outsider from Seattle. He said, I don't want to talk about gun control and I don't want to talk about pregnancy. And so then I pointed out to him that Clay Elm had the highest teenage pregnancy rate in the state. And he backed down very quickly and said, no, we need something on sex education. But I wondered what the relationship was really between the health department and the hospital district.
So can I ask you, when did you serve?
I served from 1992 to 2004.
Okay, so one of the things you may have missed was in the recession 2008 through 10, almost all health departments cut out all direct services. And most health departments now only provide environmental controls, disease control, that kind of thing, not direct services, for example, to migrants. Now, some may, and I don't know about that one, and you can probably answer for Chelan County. I don't know what their health department offers, but in most of the state, the Great Recession took away the opportunity to fund those direct services. They do still provide those services, yeah. Not all. Not all. No, some do, some don't.
Yeah, just add in terms of Chelan County, and I know they have an active, really an ongoing communications between the two, Cascade and the Chelan County Health Department. You know, I don't know all the details as being a volunteer, okay, but it's really active. I think one of the areas where they've had a really impact is in terms of providing these clinics out around this large geographical area, all of which is in Chelan County, and I think that's been a big help to getting that information out to, and providing services and vaccination services and other kinds of things like that that can be taken out away from the Leavenworth to these remote communities.
What else do you want to know? I'm sure there's more.
The question was, what about hospice services?
Does your public hospital district provide hospice?
I don't think so, but I don't know for sure. Pardon? Yeah, I think we might, and I'm just not sure.
Most of the hospice services around the state are nonprofit organizations rather than for-profit, but indeed not publicly funded, typically.
Well, Evergreen, and then we have a district here in Seattle.
Yes, we can.
Well, I just know that Evergreen has hospice services, and I think our area of Seattle does also. I'm just asking about where hospice services would be in these rural counties.
I don't know in general about that around the state, but I guess, yeah.
I'm not seeing a lot of hospice around the state in the public hospital districts. So most of those hospices are provided by other organizations.
I understood that the tax levies or taxes raised are 5% of the budget typically?
Typically.
Of public hospitals. So the rest is fees charged.
Insurance company payments for coverage, that kind of thing. Yeah, or.
So the budgeting process has to take all that into account. But that's still done by the hospital board, is that correct?
Yes, on the board. Mm-hmm.
Isn't the Harborview a public hospital?
Yes. Yes.
And so it has the commission, advisory commission, like Cascade does.
Yeah. Right. As far as I know, I guess I'm not sure how they compare.
I don't think Harborview is a public hospital district at all.
I don't think it is
a
county.
It's affiliated with the University of Washington, but it does not have its own district. I think Evergreen is the only. Excuse me. I think Evergreen is the only one in King County.
That's right.
As I understand.
That's right.
And by the way, Evergreen does operate a hospice program.
I thought I saw a hand over here. Did I not? Okay. Anything else you'd like to know? Thank you for listening. I think this is a really important function. And I just want to say that I'm working on another project outside the league on free clinics and how they might get more funding. Free clinics are operated typically by private nonprofits who are serving people who can't get access to any other part of the system. They can't get access at public hospital districts. They can't get access at community health clinics. They can't get access through Medicaid insurance or anything else. And they do that by having a few administrative staff and volunteer nurses and doctors. Can you imagine relying on that? So anyway, for the very first time in decades that they've been doing this, they need more money because they're running out of volunteers. So I just want to say public hospital districts are so important as part of our healthcare system, but there are still people that don't fit anywhere, and that's what some other, like the free clinics, take care of.
Yes, and they work very well. We certainly do that at Cascade and around these remote communities, and it's really difficult. A real challenge. So thank you. That's a good comment.
Well, we thank you, Neil, for your service to the hospital district, and Cynthia, your service to the League of Women Voters. And thank you for coming and educating us. Everybody?